So we're gonna palpate on the lateral side of the leg. So what we want to do is have the leg in medial rotation, or we can also palpate this in side lying. So Rob, if you find side lying is more comfortable, we can go in side lying, or if you're comfortable with medial rotation with the leg. Yeah, awesome. So that works as well. And this allows us to kind of put the muscles in a little bit more of a straight line and to access them as well. So palpation and resisted muscle testing can be done in supine or in a side lying position. Awesome. So Rob, what I'm going to get you to do is move your feet. There we go. Out, yeah, like that. Like you're trying to bring the outside border up towards your outer shin. And we can see even as he starts to pulse that we're getting this kind of group of tendons right along the outer border here. Perfect. So I want to start up at the lateral epicondyle, and it's going to be a little bit more on this deep posterior surface of the lateral epicondyle. So if I find, here we have Gertie's tubercle, and moving just slightly laterally from that, I'm getting that joint line between his lateral epicondyle and the head or the apex of the fibula. And then for on the other side of the lateral epicondyle, there we go. I can feel just a little bit more contraction on this side here, and that's going to be part of its plantar flexion. And so it's going to come from this portion of the lateral epicondyle of the tibia, and then this proximal, there we go, 2/3 of the lateral fibula. So we can see this nice round border here. I'll just get you to relax for a second. And there's going to be that intermuscular septum. So this is going to be between the anterior shin, the lateral shin. It seems to be not the shin when it's lateral though, doesn't it? And then the posterior leg. And then right in that middle here is where we're going to find the bellies for Fibularis, Longus, and Brevis. And they're almost going to be continuous. So it's going to be really difficult to distinguish between the Longus and the Brevis. So I'll just get you to keep palpating or pulsing here. Great. And we're going to follow this muscle belly all the way down the 2/3. And then right around here, we're going to start to find the origin of Fibularis brevis. So it's going to be our distal third here. And it might feel just a little bit thicker, like there's something kind of underneath this muscle that we've already been following, where we would expect it to become more tendinous. There's still muscle belly here. There we go. And as we get 3-4 inches above the ankle, this group is starting to taper off. Still finding those borders here. Great. And we can see the tendon and the path that this muscle is taking, where it's going to hook around the back of our lateral malleolus. Perfect. And then sling, great, over towards the tuberosity of the base of the 5th metatarsal. So if I bring my fingers and strum along the lateral border here, I can feel that bump mid-range. That's going to be the tuberosity of the 5th metatarsal. And I'm just going to find the plantar aspect right here. And I'll get you to pulse slightly. And this is going to be a little bit more tricky because this the plantar fascia is really thick on the sole of our foot. And then the longest tendon is going to wrap around under the foot to the base of the 5th metatarsal. So I'm just going to wiggle the metatarsal so I can feel where it moves. This is kind of where I'm getting the end point. I can feel the bones a lot more clearly on the dorsal surface. So I'm using my thumb as a way to track where it is. And I can feel that joint line. I should be pinching directly opposite here. And I'll get you to evert. There we go again. And there's a very a slight pull. You can't really feel the tendon or the shape of it. So there's something contracting deep to where my finger is. And if I move just slightly inferiorly towards the heel, then I'm going to be on the medial cuneiform. So the base of the 5th metatarsal, the medial cuneiform, they're going to wrap under and then come with the 5th metatarsal here, behind the medial or the lateral malleolus, and then up the side of the leg. Perfect. So for our resisted muscle test, what we're going to want to do is stabilize just above the ankle and then resist the eversion and plantar flexion. So this is one that they prefer to do in supine or side lying, not in a seated position, just because keeping the knee straight helps to only isolate these muscles. The knee bent doesn't really change anything. So if you can keep everything in line with the leg, Kendall seems to prefer it there. So I'm going to resist eversion and plantar flexion. I place my hand on the outside here, and then Rob Welge to do is evert. There we go. Yeah, with your foot in plantar flexion. Awesome. So resist here. I'm going to stabilize, and I'm going to try to bring it in and down for 5, 4, 3, 2, 1, and relax. Any pain or discomfort?
Nope.
Awesome. And one more time. I go 5, 4, 3, 2, 1, and relax. So if it's easier to place your hand